I'm naturopathic Dr. Emily Lipinski, and today I'm going to speak to you about leaky gut and the connection with thyroid disease. Leaky gut, also known as intestinal permeability, is something that a lot more people are becoming aware of, and I've been getting a lot of questions from patients about it, and it's also a key area I target when I treat autoimmune thyroid disease. Leaky gut is also known as intestinal permeability, and it essentially is when the gut lining, so if you can imagine the inside of your gut, almost like the skin, we can't see the inside lining of our gut, but it's almost, if you can imagine it, it should be a smooth and patent skin, and it should be held together with areas called tight junctions. So if you can imagine that my hands are forming this tight junction, the lining of the gut should be nice and patent. What happens with intestinal permeability or leaky gut is these tight junctions loosen over time. So it's not that there's holes forming in the gut, but there's the patency of the gut is not as it should be. And when this happens, the food particles that go through the digestive process, along with enzymes and any liquids going through the body, there might be particles of that process called antigens that get out through those gaps in the tight junction into the bloodstream. When that happens, the body actually sets off alarm bells saying, there's an invader in the bloodstream. There's something there that shouldn't be. And the body does what it knows how to do. It attacks that antigen by forming an antibody and an immune complex. And this essentially forms inflammation in the body. And when this happens and accumulates, antibodies increase. And antibodies, as anyone living with autoimmune disease will know, antibodies is a key part of the autoimmune process. When someone has Hashimoto's thyroid disease, they have antibodies against the thyroid gland, primarily antibodies known as TPO antibodies, thyroid peroxidase antibodies. So there's more evidence coming out now saying that an individual cannot have autoimmune disease without leaky gut or intestinal permeability. It's actually a key factor in the development of autoimmune disease. And the other factors to the development of autoimmune disease is, first, there needs to be a genetic predisposition. So whether it's a sister, a brother, an aunt, an uncle, a parent that has any autoimmune disease. So if you have Hashimoto's, it doesn't necessarily need to be that your father had Hashimoto's per se. If your father had rheumatoid arthritis, then that would put you at an increased risk of developing an autoimmune disease. The tricky part here is that there's a lot of people that go through life feeling sick or unwell and have no idea that they had an autoimmune disease. We're just starting to understand how much thyroid disease has a root cause in autoimmune. And even with arthritis, many people have arthritis and joint pain and never ever truly identify if they have the autoimmune form of arthritis, of rheumatoid arthritis, or if they have osteoarthritis, which isn't autoimmune in nature. So some people may know if there's a genetic link, others may not. Then we need to have a trigger for the autoimmune disease, and really a trigger for intestinal permeability or leaky gut to form. So, and most of us are exposed to these triggers. So some of the triggers for the development of autoimmune is exposure to toxins. If you have Hashimoto's, some of these toxins specifically that are linked to the Hashimoto's development are PCBs, triclosan, oxybenzone, fluoride, just to name a few. There's also exposure to cigarette smoke, whether that's secondhand or firsthand. There's exposure to a Western diet, and then medications and pharmaceuticals. Some of these medications and pharmaceuticals, usually it's when you use them for a long time or you use them at high amounts. But even something like Advil can, when used in high amounts long term, may increase your risk of autoimmune. And also exposure to radiation, which, the sun is a form of radiation, but also with all the increased EMFs and blue lights, cell phones, laptops, computers, living close to hydro lines, these all increase our exposure to radiations, and these all can increase our risk of development of autoimmune. And then the final factor for risk of development of autoimmune is this leaky gut intestinal permeability. So, I've had patients say, is leaky gut, like part of it, if I have an autoimmune disease, do I have leaky gut? It absolutely, it's such a key area that we need to focus on healing your gut to truly heal autoimmune disease. And some people have very strong symptoms of leaky gut. So really bad digestive issues, struggling with constipation or diarrhea, or been diagnosed with IBS or Crohn's or celiac disease. They really have struggled for a long time with GERD or acid reflux. And then for other people, like myself, when I was diagnosed with autoimmune and Hashimoto's, I really had no symptoms of gastric distress. I still never really have, but I didn't truly heal and reduce my antibodies until I targeted my gut. So I hope this helps your understanding of leaky gut and intestinal permeability. And I will be doing a future video on some of the key therapies that I use with really good success to target leaky gut. Let me know your thoughts. I'd love to hear from you.